So these are the steps for when we first open in the morning. Typically there isn't going to be anything here because of the closing process, but wherever in the area, everybody keeps their things in different places. You'd start off with putting the towels on the trays, plugging everything in. You would go ahead and put some water in the ultrasonic. There's a little line that'll tell you when to stop, and then you would add I'd say like 7 to 9 pumps depending on how big the ultrasonic is of Maxizyme. And then while you're down here, you can empty out this, and they have a minimum line, so you'd empty out the water from the night before and then refill it with new water to the minimum line. You never want it to get higher than this because it can just damage the autoclave. And then you're gonna plug in these, and typically there's usually instruments from the day prior that didn't get to make it through the actual sterilizer, so you'll just load it in, and then that's it for the opening process of the day. So typically you're gonna get all different kinds of trays. Here I have the Profi trays, the basic trays, the resin trays, and a hygienist tray. So typically you want to separate them by tray, look at the instruments, make sure that there's no blood on them. Just because you don't want to mix the blood into this because everything goes through there, then I like to take some of the cavicide and let it soak on the tray and just put it under each tray. So you just do that throughout the process. Then you have the x-ray holders. You're gonna typically know what x-ray holder goes with what. It's usually red with blue, or sometimes you have the rings and it's still gonna be the red with blue with just a ring and like a little connector. For the hygienist trays, they usually use what's called a Cavitron tip, and then they have their Profi heads. They change their Profi heads for every patient they have. Those don't go through the ultrasonic. And there's a list here of everything that doesn't go in. So that would be the Cavitron tips that I just showed you, any kind of motor, the syringes that they use for the surgeries, and a fish, which is something else that they use for the surgeries. You clean the Cavitron tips and the syringes and the motors with the Cavicide too. Specifically with resin trays, you're going to want to look and make sure that there's nothing left over. So like on the little spatula, sometimes there will be like white residue left over, and that's basically what they use on the patients. So to get rid of that, you just want to take another tool and kind of just scratch it off. Just because once you go through the actual process of the sterilizing machine, it can get hard and not want to come off anymore. So once you got all of the trays in here, you're just going to turn it on. It's already on. 5-minute mark. You usually want it at 5 minutes. The longer, the more you turn it, the longer it'll be in there, but you really only need it in there for about 5 minutes. So after you're done with that, you have all of your motors in front of you. I like to put Cavicide on them before I start actually cleaning them. So with the resin trays, you're going to get all of these. Unless the doctor or an assistant actually asks you to throw them away, don't throw them away. You're just going to put them to the side in one of those. And then with the motors, you're just going to put hand piece spray in it. And then since I don't have a double hand piece cleaner, I just put it into one of these and I just put it through. And then with this one, same thing. You're just gonna make sure that you always put it in the smaller hole, which would be the one usually on the left. And then you just match it up. let it run for a couple of seconds. And I like to just respray it again. Then you're going to take some of the gauze, and then since this is what I use, I just put it back where it's at. You just wipe off all the motors and make sure that you really clean all of the gunk off of that. So that usually comes with the hand pieces. Just make sure you're cleaning it until it's clean, and then I turn it over. And you just wipe through everything thoroughly. So I like to let those dry for about 3 minutes, sorry. And then you just wipe off the trays, and then I like to take them over here to the other side. The other side of each sterile area is going to be considered the clean side, that you don't ever want to bring anything that's over there, over here. And you just let that dry for, you're going to want to let it dry for 3 minutes because it gives the cavicide enough time to actually kill the bacteria. So you just do that with all of your trays, stack them up nice and neatly. And I usually just do this while that's running. So after the 3 minutes of letting the cavicide dry onto the instruments, you're typically gonna kind of know what fits in what package, but you always want to make sure that there's enough room for everything, specifically with the bigger packets, because you want to make sure that everything is getting sterilized properly and has its own room. You don't ever want something to be too overcrowded. And you always want to make sure when you're packaging that you're folding on the line. You don't want to have any open holes because that allows the water from the steamer to get in. You want to avoid that. And then we're going to go over here to the ultrasonic. Since the 5 minutes are up, you're just going to take them out. You're going to run them all through water. Shake it off all of it. The x-ray holders get put separately, obviously. So with the packages, you always want to take out the mirror and then just package them to, sometimes the hygienists, the assistants, or the doctors will tell you if they want something in a specific package, but for the most part, you're just going to be able to eyeball it and know what goes in what. Then you're going to take one of these and always put it around the mirror. It kind of just protects the mirror from getting scratched by other instruments while it's in the package. And that's basically that for packaging instruments. So here I already have the sterilizer all filled up, but on the bottom trays you typically want these, any kind of instrument package you want down here. You kind of want it like perfectly fit. You don't ever want to overpack it because then that's not making sure that everything gets sterilized properly. Any kind of motor or like Cavitron tip or x-ray holder, you want to make sure only goes in the first two, because if you put them all the way at the bottom, that's where most of the heat is that you don't want anything to melt or break because it got excessive heat put towards it. So I have all of the motors, and you can even put any kind of other dental instrument packets in the top. Those ones don't matter, but just be careful for all of the motors and all of that stuff. You just load it up. You want to make sure that this is closed all the way, just because sometimes the water can leak and you don't want anybody to slip and fall. Then before you press start, you're going to want to check up here and make sure that there's enough water. There's enough water in there. You'll be able to see it once you're actually up close. And this is usually already set. You don't ever have to touch anything with that. You just click start and then it starts on its own. And then with this machine, you just take it out, you open it. I typically like using this one for the motors, anything plastic, and you just make sure that everything is lined up in there. You take these, you can just fold them a bit. Just any way that anything will fit. You put the tray on top, and then you can put more stuff here, just as long as nothing is overlapping. You close it, put it in here, and you make sure that there's enough water in this one as well, and there is, so you can just leave that. And then you have 3 different settings here, the ones that you'll use the most. You have the unwrapped, if you need something very quick. We never really put anything unwrapped in a sterilizer. Then you have the wrapped, which would be all of the metal instruments. You typically rarely ever will put these in there, but sometimes you just have to, and you would put wrapped for that. And then you have the rubber and plastics, which would be the motors and the stuff that we just put in there. You never want to mix that stuff with the dental instruments, just because if you were to put it with the dental instruments, it would just get a lot hotter and it could melt the pieces. So you would just do rubber and plastics, because that's what we put in there. You press start and then it would start the cycle, and that's it. So at the end of the day, for the closing process, you're just going to do everything that you did for opening, but you're going to reverse that process. You're going to take all of the towels off. You're going to unplug everything with the ultrasonic. You're going to turn the valve so that all of the water comes out. You're going to unplug all of these machines, and then you're going to wipe everything down in Cavicide. Just spray it all, let it sit a little bit if you prefer, and then take these and just wipe everything down. Make sure you get everything clean. And that's it for the closing process.